Hello everyone, I'm Dr. Aslam, specialist pulmonologist in International Modern Hospital, Dubai. I work here in the International Modern Hospital for last 4 years. I have around 10 years of experience in pulmonary medicines, both from India and United Arab Emirates. Today we are talking about one very important disease which you all know, asthma. Asthma is very common. It is present in kids, pediatric age groups, adult, very elder. So every population asthma is there, and the number of the cases are now increasing also. So what is asthma? How it causes? What are the symptoms? How doctors diagnose an asthma? And what is the treatment option? Is there any newer treatment options are available? So we will discuss all these in just 20 minutes time. After that, we can have a live discussion also. I can query your questions regarding asthma, diagnosis, management and all the things. So now going about asthma, how it manifest asthma. When we see a patient, what patient we diagnose as an asthma? Asthma is a chronic condition. Chronic condition means it lasts a longer duration, and one of the main reason for asthma is it is triggered by something. Every asthmatic patient will have a tendency to get asthma. It is a inherited one. But when they are exposed to that triggers, they get some symptoms. These symptoms happens when you are exposed to a trigger in your body, especially in the lungs, the airways. There is a increased reactions happens for that triggers. So the airways become very tight, more secretions happens, the airway gets blocked. So the symptoms, the difficulties happens. So what are the symptoms of asthma? One of the most important symptom is breathing difficulty, or a wheezing sound, a whistling sound from the chest when you breathe the air, or some people feel only chest tightness, heaviness in the chest, some only coughing. There is a misconception that asthma people will always have breathing difficulty. No, asthma can present as even just as a persistent cough also. So how other coughing or other breathing difficulties are different from asthma? Breathing difficulty or coughing can happen in many other diseases also. So in which scenario we suspect asthma? If these problems happens in an episodes, in a frequent way, for example, every month you get 1 or 2 days, or every years you get in 1 or 2 seasons, like that, episodes, in between you will be completely okay. This is a peculiar symptom of asthma. It will not be there on every day. It will be, some days it will be there, some days it will not be there, like that. So there will be a days of problems, then there is a completely symptom free interval will be there. This is very peculiar for asthma. Why this happens? As I told in the initial, these symptoms happens when you are exposed to a triggers. There are many type of triggers are there. One of the most important trigger is dust. The dust has a microorganism known as dust mite. This dust mite is the one of the very important cause for a trigger for asthma. Other one, funguses, the molds, funguses which are seen in our home atmosphere and all the thing. The funguses which is present in the air circulation, the air conditioners, strong smells, sometimes infections. When you get a respiratory tract infection, that can also trigger asthma. Some people some food items can trigger asthma. Even some exercise can sometimes trigger the asthma. There is a condition known as exercise induced asthma. They get the asthma symptom only after the exercise. Some after taking some drugs like aspirin and all the thing. So drug induced asthmas are there. So there are many triggers are there. We classify it as a breathing trigger, that is the respiratory allergen which goes through your nose, like the dust and other chemicals, the plants, pollens, many things, and cold environment, climate changes, sandstorms, many triggers are there. So unless you are exposed to the trigger, you may not get the symptom. So once you are exposed to the trigger, you get all these symptoms. Now you have these symptoms and you have this history. Now how it is being diagnosed, whether it is an asthma or not. To diagnose that, the doctors will mainly use their history first, like this episodic history which happens at a regular interval, triggered by something outside external stimulus. So these are all the history. Then there may be some family history of asthma or a family history of other allergic manifestation. These are all belongs to some allergic spectrum, like an allergic rhinitis, that is the sneezing, sometimes eczema, the skin allergies. So these are all can be a part of one spectrum of allergic diseases. So a family history. So a patient coming to a doctor with a family history or these type of recurrent episodes of the breathing difficulty or cough, then doctor will suspect that this is having a asthma. So we have to work up, we have to make a diagnosis. How the diagnosis is made, what is the test? So we have a test known as spirometry, that is the pulmonary function test. It's a computer based breathing test. So where you will be requested to blow your air into that device, and the computer will assess the pattern of the air coming outside, what percentage of the block is there, like that one. So it has a two step. One initial step, you do the breathing test, then those who are performing, the technician or the nurse, they will give you a medicine known as bronchodilator, that it's a puff medicine or a nebulizer medicine. So that medicine will be given, and after 20 minutes again the test is repeated to see whether there is a difference of the test before the medicine and after the medicine. There are some criteria are there. If you met that criteria based on that test, that is 100% prove that you have an asthma and you need to go for the treatment purpose. This is one of the tests only. There are many other tests also there. This is the basic test. But one important thing is that even if this test is becoming normal, based on the other parameters, other histories and other tests, asthma can be diagnosed. But most of the time this is the basic test, the standard test. Then there are other tests to assess the allergy levels in the blood. It is known as the immunoglobulin IgE levels. Then specific IgE tests. Specific IgE means to identify, I told you initially, asthma is triggered by something. To find out what exactly causing the trigger, whether it's a respiratory trigger, whether it's a food items, we have a specific IgE panel tests are there. With that tests, we will get a clue regarding the trigger. And there is for the allergy, there is another skin prick test also available. Both type of the tests are there, either a skin prick test or a simple blood test also available. Then there is other checking known as eosinophilia in the blood will be also checked. These are all the common things done for the diagnosing an asthma thing. So now the coming to the treatment part, how the asthma is treated. So there is a protocol is there, there is a guideline is there to treat asthma. First you make a diagnosis, how to treat. Coming to part of the treat, I will be concentrating more about the treatment part, because everyone will know, they know the majority those who are watching may be either suffering from asthma, or there may be some of the family member may have the asthma. So everyone will be more curious about to know how it is being treated. Is there is a permanent solution? Is the drugs are safe? Is there is a newer modality of treatment is available? So I will be focusing on next 10 minutes. I will be focusing on the treatment part. After that, I can answer your questions also, which comes through the in the live session. So coming to the treatment part, the one of the most important treatment option sorry, the most important treatment option is inhaler therapy. You must be seeing when an asthma, if you hear an asthma, most of them will get that picture. In movies and other things, you must have seen someone is using an inhaler. Yes, inhalers are the best and the safest medicine. I will tell you the safest medicine, because there are so much myths about the inhalers are there, but these are all wrong. This is the safest medicine for the asthma control medicine. There are different varieties of the inhalers are there, mainly two types. Immediately giving relief type, that is known as reliever medications. Other one is the controller medicines. We definitely need a controller medicine. Reliever medicines are for the emergency use. Many will be aware about the salbutamol, the Ventolin, the Asthma and all the things. These are all known as the reliever medicines. One common mistake asthma patients do is that they keep on using the relievers, the Asthma, the Ventolin, the salbutamol one. They keep on using it. Whenever they have the symptom, they use it, press it and use it like that. Immediately, definitely they will get the relief, but it is not going to control your asthma. To control your asthma, there are different type of combination inhalers are available, and there are different classes are available. Previously, we were available having some medicines which we put in a capsule, then pierce it, then inhale it. Later, press type medicines came. Now there are other recent advanced medicines are there. Previous medicines were having action of 12 hours only. Now we have a 24-hour action medicines like that. You use only one puff per day. 24-hour is safe. No other issues. So like that medicines. There are triple combination. Those some people will have, even with the basic medicines, their asthma may not be controlled. So that they will have a triple combination medicines are available. Then there are asthma controlling tablets are there, small tablets are there which you use for the asthma controllers. Then coming to there are the latest technology, latest medications are also available. These are all known as the monoclonal antibody medications are available. This is reserved from special category of the patients only, not for all patients. Majority of the patients can be treated with a simple inhaler therapy and asthma controller tablets. But for some few patients, those who are having a very severe asthma, not at all controlled with the normal inhaler or tablet medicines, there are newer medicines known as immunotherapy medicines are available. So what is an immunotherapy medicines? So immunotherapy means first you have to identify the trigger, what exactly is causing the trigger. So this is based on your own observation plus tests. Your observation is very important. If you can observe and find out, it is very useful, so that we can easily go to, we just need to confirm that only. Sometimes it is not possible to find out from our own observation what exactly is causing the trigger. In that cases, as I told previously, we have the tests known as the allergy panel tests, specific allergy panel tests, and skin prick tests, and all the things are available. So based on this test, we will identify which is causing the trigger, and if that trigger is very highly sensitive for you, then there are treatment for, it's like a vaccine for an infection. This is a vaccine for allergy. So you give that medications prophylactically, then slowly your body will get desensitized to the external triggers, and you will be happy, and the symptoms will be well controlled, and you will be symptom free for a longer time. So that is about the newer therapy medicines and all the things. Now coming to one most important aspect of the asthma treatment is, other than the medicine, the lifestyle modification is very important for a complete, for example, for you in your word, for a cure, for the cure of the asthma, that is a complete lifestyle modification is needed. So what are the lifestyle modification needed? It is mainly the identifying the trigger. I am stressing again and again, asthma is a triggered disease. So identifying the trigger and avoiding that trigger in your day-to-day life is the lifestyle modification you have to do. Unless if you are using only medicines for a long time, take the medicine, when the asthma episodes come, you use the medicine, make it controlled, again they use medicine, then it's a lengthy process, it's a chronic disease. So to completely control the disease, the lifestyle modification is very important. So what are the lifestyle modification? The commonest trigger, as I told you, is the dust. In the dust there is a microorganism known as dust mite. This dust mite is the most common triggers when we do the allergy panel tests and all the thing. What we identify is the dust is the most common trigger. In that, when we hear the term dust, in our mind it is coming the outside dust and all the thing. Sorry, that is not the main trigger. The main trigger is your indoor dust in your house, in your office. That is the main trigger. So that dust mite is seen inside, it is living on your blanket, your bed sheet, your pillow covers, like that area. They, wherever you spend the life, like you sleep for 6 to 7 hours in the bed, or you spend in the sofas, like that. In that area, in that sofa covers or the pillow covers or in the bed sheet, there is a dust mite organism will be there. So that is the one of the commonest trigger. So to remove that, how to reduces this dust mite exposure? So one of the most important thing is a technique known as warm washing. Warm washing means you take the your dress materials, the blankets, the pillow covers and all the things, put it in a warm water, soak it in a warm water for a 10 to 15 minutes, and after that you do a normal wash. So that is known as warm. In a normal wash, this dust mite may not be killed. So you will need a warm washing. This warm washing you will have to do at a frequent interval. Then wet mopping of your area. Some people will do cleaning the rooms to completely avoid the dust, but a dry mopping, the dust will go up and collect in your air circulation and all the thing. When next time the air circulate, it will again come down, like that. So you have to use a wet mop. Take a wet cloth, mop all the floors, your furnitures and all the things which attract these dusters and all the things. Then one other trigger is the kitchen areas. Kitchen areas, it is it's a very strange thing that cockroaches which is seen in the kitchen areas is one of the trigger for asthma. Many of the studies and many of the allergy studies shows cockroach as a sensitive. So in the daytime you may not see the cockroaches in your kitchen areas, but in the night time when you switch on the light, you can see so many cockroaches. These cockroaches is one of the very important trigger for the asthma. So you should identify whether there is a cockroaches are more there in your house, and that their insecticide, pesticide methods you have to use to kill the cockroaches and all the thing. Then air circulation, the air conditioner, the filtration of the air circulation in your room. Every air conditioners will have a filtration methods and all the things. So every at a frequent intervals, they will have a service interval. Every frequent interval you should clean that, otherwise that will attract so much molds, funguses and all the things that you inhale, and the asthma triggers and all the things happen. Then avoid the wet areas in your kitchen and washroom area which attract the funguses. Fungus is also very common. Then outside, when you go the outside, especially in the Gulf areas and all the thing, the sandstorm is very important problem. In the sandstorm there will be so many microorganisms, dusters and all the things which triggers. One other trigger is the climate change, extreme temperature. Some people, those who are having asthmatic and all the things, they put their air conditioner in 18, 19, 20 ranges and all the things. It will trigger, the cold will trigger the bronchospasm. So the an optimum temperature will be around 24 degrees Celsius, like that one. So that will be the best temperature for an asthmatic patient. Then frequent in the climate, in the seasonal changes, some seasons infections can trigger asthma. Those who are having a history of asthma history, infections can trigger. So yearly vaccination to prevent the infections and all the things are very important, especially the in flu vaccinations, and those who are having the now everyone must have taken the COVID vaccination and all the things. So these type of the vaccination which prevent the infection, because when there is an infection is there, the asthma will also become more. So these are all the common thing about the treatment purpose. So the very important thing is that inhaler is the best medicine, and the lifestyle modification is the very important part for a permanent solution. And before I winding up my session, just about the inhalers, the doctors usually prescribe the inhalers, and there are many social stigmas are there about inhalers, whether it has a more side effects, like that one. So inhalers are a local delivery mechanism. Local delivery mechanism means when you have some eye problem, you put some eye drops. When you have a nose issue, you put a nasal spray. When you have a skin issue, you put some ointments. Like that, when you have the lungs problem, the airway problem, you take the inhaler. It is not going to the blood, it is going to the airways. So the systemic absorption, the medicine going into the blood is very minimal, far less, near to zero, like very less only. So the side effects happens when the medicine reaches in the blood and goes to the unwanted areas of the body. So here the medicine is not going to any other places, it is going to the lungs only. So the side effects are very less. Some local side effects are there. So to prevent that, we ask them, anyone who is using the inhaler, after taking the inhaler, gargle your mouth and spit it out to prevent some white coating in the tongues and all the things. So that is one of the side effects. So otherwise there is no major side effect, and some people think there is an addiction for this. Once you start the medicine, you become an addicted. These are all myth concept. So the summary is that inhalers are the safest medicine for the asthma, and identifying the trigger and making a lifestyle modification is also very important. So overall, this is about the asthma, the symptoms, in how we diagnose, how we treat, and all the thing. What is the newest things are available. So now this is the time for to answer your questions. You may be having a different set of questions. So I am happy to answer your questions. Thank you. can now also comment. The first question is that doctor, I would like to know if there is any permanent solution for asthma. Yeah, it's a very good question, and most of the patient will ask, and I have mentioned about it in the discussion part itself. Asthma is a chronic disease, not like any of your pneumonias, fever, symbol like. It's like a chronic disease. Chronic disease is a long term disease. So, the main treatment aim is control of the disease. The main treatment aim is control of the disease, because you will have that tendency in your body to get triggered. You cannot avoid that tendency, you will have that tendency in your body. For example, if you are allergic to a dust, you will have a tendency to get triggered to the dust exposure. So, when there is an asthma happens, we treat with the controller medicines plus lifestyle modifications, and if you identify your exact trigger and if you are able to avoid the trigger, it is a permanent. It is not an easy task. So, there are medicine, as I told you, the immunotherapy medicines are also available, so that next time when you are get exposed to the triggers, you will not get the asthma symptoms. So, asthma, the best term is it is equal to curable. Equal to curable means with the available medications, identifying the trigger, avoiding the trigger, or using the latest immunotherapy options, you can make an asthma like a curable condition. So, that is the answer for that question. Now, the next question is, when should a child see an asthma specialist? Yeah, it is a very good question, because asthma is one of the disease which start from the childhood, from the age 3 years, 4 years, like that age itself asthma symptoms starts. So, when to suspect an asthma in a child? Like most of the asthma in the childhood, when to suspect a asthma in a childhood, when you have a symptoms like breathing difficulties, the child is getting recurrent breathing difficulty or a whistle like sound when he or she breathes, or when there is a continuous cough, more in the night time, not in the daytime, more in the night time. If you get a continuous cough and all the things, that is a symptom suggestive of a asthma. So, in that situations, you have to first visit your pediatrician doctor, the child specialist doctor, because not all cough or not all breathing difficulties are not asthma. So, they will check whether it is suiting for an asthma diagnosis or any other diseases. So, first primary evaluation will be done by the pediatrician, and they will start the initial treatment also, and then they will refer to the specialist for the further care and all the thing. Okay, now there is other one question is, when should that we answer, are asthma medications are dangerous and addictive, doctor? That is the question. So, that is also we have in the description, we have the initial part, we have already told asthma medications are very safe medicines. Why? I told initially itself. If you see the asthma medicines concentrations, it will be in micrograms. If you see a paracetamol, it will be in the milligram, 500 milligram, 1000 milligram, or a Brufen 400 milligram, 600 milligram tablets. Microgram means 1 in 1000 like. So, it is very less dose. Why this much very less dose? because it is going directly into the lungs. Like I told you previously, for an eye problem you use an eye drop, for a lung skin problem you use an ointment, for a nose problem you use a nasal spray. Like that, this for the lungs and airway problem you use a inhaler. The dose is very less, 1 in 1000 of a, like a other medication dose which you take as a tablet. People are very comfortable to take the tablet at any numbers. They don't fear about the side effects, but when it is prescribed part about the inhalers, so many worries will happen, whether it will become an addictive and all the thing. No, it is not an addictive medicine. There is no narcotics, nothing like that, no addiction and all the thing. When you use the medicine, you get the benefit, that's only. So this is the safest medicine, there is no addiction and all the things. Other one question is there any relation between Voltaren injection and asthma patients? It's a very good question. Why? I told you asthmas are triggered, always triggered. My today's topic is based on that factor only, trigger. If you identify the trigger and if you avoid the trigger, class, your asthma is completely cured. So the trigger is the problem here. So Voltaren is a painkiller medicine. Painkillers are known as NSAID class. So these NSAID class, non-steroid anti-inflammatory drugs, NSAIDs, Voltarens, aspirin, many things, these can trigger asthma. There is a chemical mechanism involved in that. So these injections can also produces asthma. So what we will do, there are few patients who come to a hospital with severe breathing difficulty after they got some painkiller from outside doctors or other hospital because of some other issues. The problem immediately after taking this painkiller medicine, they get a severe breathing attack, breathing difficulties, very severe bronchospasm, oxygen level going down. Then some land up in intensive care unit itself. So we had patients like that. So that the prevention is those who are having asthmatic and all the thing, before you go for any painkillers, tell to your doctor that I have a history of asthma, and my specialist has told me to use with precaution for the painkillers. So there are some painkillers which are safe and which are not safe, comparatively safe, which will not produces this asthma attack in the asthmatic. So that doctor will select the painkillers which are more safe for you. Not all asthma patient will get the attack with the Voltaren or these painkillers, but there are few people they will get. So it's better to avoid such medication which are known to produces this attack more. Then try to use the other type of the medications. Now these are all the questions we got today for asthma issues. We have discussed this topic now for about half an hour. Let's see any other question is there, or otherwise we can wind up the session. It was a very nice evening to interact with so many people, those who are watching online through our YouTube page, through our Facebook page. I hope everyone must get some idea about the asthma treatment and all the options. Our hospital is equipped with all type of diagnosis, treatment, critical care facilities, allergy checking, everything for the asthma. So if anyone want to use such facilities, you can contact our hospital, and the hospital departments, we are a multi-specialty hospital with all type of departments, cardiology, nephrology, intensive care unit, gastro medication, surgeons, laparoscopy, gynec, pediatrics, dermat, ophthal. So all your problems related with asthma and other comorbidities which are happening, sometimes asthma control will need other specialist help also to control the comorbidity. So all the specialists are available. So thank you for watching today's session. Have a nice day. Thank you all.